Now, people or the patients having diagnosed with the personality disorders, and now we are going to start off with the assessment of these individuals. So, we have basically divided these personality disorders into the major chunks of the personality disorders, ranging from the cluster A, cluster B, and then we have the cluster C individuals over here. So, when we have a look at the summarized view of the people who are belonging to the subsequent sections, that is the cluster A and the cluster B individuals, they have these particular traits that are categorizing them into these particular chunks. People who are belonging to the cluster A group are usually odd and eccentric. They are going to have that predominant behavior of antisocial personalities. That is going to be the highlight of this chunk of people who are belonging to the cluster A group. And then when we talk about, or when we diagnose a person as having suffering from or belonging to the cluster B group, usually these people are more of the expressive kind, and that is basically they are going to be more emotional in their views. They are going to be more of the impulsive sort. They are going to be suffering from the borderline personality disorders. They are going to be narcissistic in their views, or even histrionic in their views. So these are the major characteristics of the people who are belonging to the second section or the second group of diagnosis, that is the cluster B group of the personality disorders. Then we move on to the cluster C group of personality disorders, and the primary thing or the primary setting for the diagnosis of the people who are suffering from the cluster C group are the fearfulness. So they're going to have that fearfulness, and they're going to be anxious in their thoughts and in their behaviors as well. So having that intense fear, having that intense worry of something bad is going to happen, or something is wrong in their surroundings, or something is not right about the people in their surroundings. So this behavior is going to reflect upon their lives, and even they're not going to cope up with the normal stresses of life. It is going to be quite difficult for them to develop those intimate relationships and even those pure relationships at workplace, at school. So diagnosing the young people or the young lot as suffering from this particular kind of a personality disorder, one has to be quite conscious while you're diagnosing someone as suffering from the cluster C disorders, because it's again very significant for their future life. These people who are suffering from this particular kind of a personality disorder can develop some sort of a very late onset schizophrenic disorder, or some sort of the obsessive compulsive disorders as well. Usually the behavior that is sought out in these kind of people are, they're usually avoidant in their behavior. They're not going to be quite friendly with the people who are surrounding them. So usually sometimes they develop that dependent kind of behavior as well in their overall life stresses. Even the normal life stresses can develop into this cluster C disorders as well, and can move on to this cluster C disorders as well. And then we have this obsessive compulsive behavior that is sometimes quite predominant in these individuals who are suffering from the cluster C disorders. Now, what is the reason for the development of this avoidant, this dependent, and then the obsessive compulsive disorder in these individuals? It is the anxiousness, it is their anxiety or the fearfulness or the extreme worry about the future, and it can be even about the present. That is making these people more anxious, more dependent upon their surroundings or the people who are surrounding them. So this is the highlight over here that we're going to focus on while we're dealing with these people who are suffering from the cluster C disorders. The counseling sessions, the treatment guidelines obviously depend upon the behavior that is more predominant in these individuals. Depending upon the severity of the disease, we're going to guideline the treatment of these individuals. Either it can be the pharmacotherapies alone, or either it can be the cognitive behavioral therapies, or if it is a milder form of a disease, it can be just the counseling that can review these patients, and we can help these patients out of the difficult situation that they're suffering from in this particular kind of state. So the cluster C individuals, they include the patterns of behavior that are essentially fearful or anxious. So this extreme worry is the causative factor for the development of this cluster C disorder, tend to be perfectionist or rigid in the standards of expectations for themselves and even for the others. So the high level of expectations can be one of the leading cause over here. That is again due to the extreme worry and the fearfulness. They're relatively unlikely to seek treatment as well. Now, when we talk about the people, there can be these particular kind of traits that are predominant in these individuals. Some of the people have this avoidant kind of behavior that is quite predominant in them. They demonstrate the marked feelings of inadequacy in them, and then they're associated with the hypersensitivity to negative feedback or even the social inhibition. So the antisocial behavior is the avoidant behavior that we're talking about due to the negative feedback of the individuals in their vicinity. They seldom put themselves in risky or even the new situations in which they perform quite poorly. They seldom develop the intimate relationships as well. They may constrain the occupational chances based on the fear negative judgments as well. So when we talk about another kind of a trait that is sometimes quite predominant in these individuals who are belonging to the cluster C group, it can be the dependent behavior as well. They seek someone to take care of them, even to the extent of being submissive to these individuals in their surroundings. So the clinging and the fearfulness of sensation. So this fearfulness is again quite predominant in these individuals who are quite predominantly dependent on the individuals in their close vicinity. They avoid the decisive actions and allow others to make decisions for them. They are subservient and makes difficult to express the disagreement when asked to take the unpleasant activity along with them. So when we talk about the obsessive compulsive disorders, this is again one of the personality traits that is sometimes quite predominant in the people who are belonging to this cluster C group. The diagnosis, when it is made, the family of the OCD treatment steps are discussed over here. The step 1 is the identification of the triggers and the behaviors. So the thought content has to be identified first of all. What is the kind of thought content in these people? And then prioritize and design the treatment accordingly to these OCD people. And then we have to teach the family to deliver the treatment. So it's again very important. The environmental factors are sometimes the triggering factors as well. So you have to treat the family as well. And then you have to implement the treatment in the fourth and the final step. Well-controlled perfectionist patterns of behavior at the expense of the efficacy, flexibility, and the spontaneity. So they are sometimes perfect to the level of the extreme perfectionism and often some preoccupation that tasks are not completed. So this perfectionism is at the level that sometimes or most of the times the tasks are not completed. There is a difficulty delegating responsibilities and often tend to work for long hours to meet their standards of perfection. So in this section, primarily we discuss the cluster C group or the people who are belonging to this cluster. What are the primary personality traits that they are suffering from? So that is the end of this section. Thank you for watching sqadia.com.